Missy commented that she's having a little bit of right-sided shoulder pain. And it wasn't pointed, it wasn't deep in the shoulder joint. She just generally felt like the shoulder was rolled forward. So I'm going to work to open that. It's almost impossible for me to work on the upper back without also working on the neck and the shoulder, the connections between those. As I'm jostling the shoulder, you'll notice that I'm allowing her head to move side to side with the motion. I'm seeing what mobility exists here. If her head is down, I can press from side to side, back and forth. I'm working around the shoulder blade. I can hook in, maybe engage, a little jostle. She seems to like that one, so I'm going to roll the other hand under as well. And I can jostle side to side. Always trying to make the work as effortless for me as possible, while also being as effective as we can be for the receiver. Encouraging them to let go through the upper back and neck. If I lift and move and back down, and lift, and now I can lift and then push away. Again, just tons of movement, just allowing that movement. I can block with the forearm there if I want. I'm gonna slide out over the shoulder. I've got a broad palm grip over the shoulder, and I'm just sliding out and down, reinforcing that connection out over the arm. When I work with students, I usually give them sequences. And a large part of me teaching those sequences is trying to get the students to destroy the sequence. You're teaching them scales so they can learn to play jazz. I want them to have enough of a background to know how to work with common complaints and then be able to improvise. In her case, I think she really likes this, even though she's not giving me verbal feedback as such. She's smiling, I think I was correct. To exaggerate that, I'm going to take the arm, cross it over. I'm able to hold this in place from here, and then engage this little loop down around the arm. That little slide I was giving is now a little higher up over the arm, the deltoids. You don't have to know every single muscle. You can always go look at anatomy books, get a little more information. But a lot of it is very simple. It's something anybody can do. Don't feel like you can't massage your friends and family because you don't have a license. It's not needed. There's always stuff you can learn by going to a school, and I'd never want you to not get more education. But you can work on people easily without having a license. If I lift and jostle that shoulder. Slight movement. And arm back down. I'm gonna lengthen through the neck. We've opened this up. You can probably see just a little bit of therapeutic inflammation just from the skin pressure there. If you're thinking about the shoulder and the upper arm, you're thinking about the shoulder blades and the neck as well. The nerves that go down the arm exit from the cervical spine, from the neck. A little traction and lengthen, mobility. This shoulder to me visually already looks like it's rolled out and open a little bit more, even though we rolled the shoulder forward. Sometimes if I'm trying to get a person's shoulder blades back and down, it feels like I'm fighting. Sometimes what I actually do is exaggerate the shoulders forward, and then when I let them go back to whatever neutral is, they fall back and open. I don't even have a scientific reason why that happens, but I always go with what works, and then I ask more questions about why in clinical experience that seems to happen. I'm gonna lengthen the neck on one side, gently and slowly. And the opposite. This time I'm going to turn the head to the side. This way I can lengthen. So right hand goes one way, left hand goes the other. It gets all these attachments through trapezius from the neck to the shoulder blade. You can lift and engage a bit of movement along with that slide. I'm not using any cream, so there's a good bit of traction, which I actually sometimes prefer. Getting that lift, sliding out and over. You'll see that my forearm is planted into the table. It gives me some leverage to lift and lengthen. I'll always roll the hair under so it'll get a snag. And we can try the opposite side. It's more about feeling than it is thinking. Once you have an idea of the landscape, you can even blindfold yourself. You're trying to increase tactile sensitivity, touch. The quality of touch is way more important than what you read in books. You can know origin and insertion of every single muscle. Doesn't mean it's necessarily a good session. Then back to center. I'm going to reach down. My fingers are right along the right side of her spine, sliding all the way up to the base of the skull and out. Reverse sides, right along the left side of the spine. To the base of the skull and out. And then possibly both. I'm going to lift. I can balance her on my forearm, maybe to one side, gives me a little lift there. I can grab to the center and then let her roll onto both forearms. Now I press on both sides. Lift and lengthen. If your hands aren't quite strong enough for this, don't stress about it. You will build a degree of hand and forearm strength as you work on people. I've been doing this for years, so my body does it fairly easily. I'm gonna grab right through trapezius. This little guy I'm pinching right in there. Not too much pressure, Missy? Okay. Now I'm gonna hold here and then push the shoulder away. Remember our old friend, that little bit of a wrap? If I lift her, get some pull there. Gonna move just a little more lateral out towards the shoulder. Lots of this developed organically in my work. People tell me when I work on a mat, it reminds them of Brazilian Jiu-Jitsu. It's almost like joint locks at times, working around structures. Lots of pin and stretch, holding a muscle. That feels very dense. How's that right there? Is it too much pressure? Okay. And I'm just checking in because the density of what I was pressing in, if I pressed much harder than I am, I think it might be a bit too much. But I'm trying to make sure, since I'm working with her, and I haven't previously, that it's just the right amount of pressure. It's enough to be engaged. She's paying attention to the contact. She's focused on this, but it's not painful. I'm gonna give a little bit of jostle. And I'm gonna lengthen, mobilize around. Get a little more lateral. All tissue, right near bone, right near the shoulder blade in the back. As we're working through trapezius, I'm also getting a bit of supraspinatus. We covered infraspinatus on a previous video. Supraspinatus is above the spine of the scapula, so the shoulder blade. I'm hooking in right there. And I'm sliding along. All feeds right into the head of the humerus, that connection there. I'm gonna get a grip and slide out again. How's that, Missy?
It's great.
Yeah. Just giving her a little bit of length. You'll notice that she was complaining about her shoulder. She was complaining about the shoulder rolling forward. I'm just working movement around that area. Sometimes I just don't know exactly where discomfort, out of place, comes from. It's hit and miss. She describes what she's feeling, and then I try to figure out what soft tissue is influencing that. Again, I'm hooked in, very broad, flat knuckle through supraspinatus at the top of the shoulder blade. Supraspinatus above the spine of the scapula. Infraspinatus, like infrared, it's below the spine of the scapula. Slightly different movement there. And hook a thumb through that spot. Now, I've got some pressure. That feels good to me right there. I'm gonna use some movement of the arm to access that tissue. Most of the pressure is in my right thumb. I'm gonna move a little lateral and engage just that bit of movement. And I slid out. Can test around trapezius again. This feels much more open until we get down towards the shoulder. Some of this right here still feels a bit dense. She's nodding.
Yeah.
Is it too much pressure?
Oh, you're right there.
Okay. So no more than that?
You could go a little bit further when you were...
When I'm going across the fibers. Yeah. So when I was going across the muscle fibers, it was a little too much.
And it's more too much in front. Mm-hmm. You're great.
But not here, it was just where the thumb is. So I can engage pressure, I just can't roll back and forth across the muscle fibers. Right there. Now, my thumb starts to get a little tired. I'm gonna use the other fingers to just reinforce so I can hold there. What happens is I'm able to relax my right hand while the left fingers push my thumb in just to deliver a little bit of pressure there. I'm moving just slightly more laterally. She took a big breath because she is a wonderful client, and she knows how to breathe. And let go. Slide just a little more lateral so I can come out and jostle again. And I'm trying to think about what hand position I can use to get in to here. If I turn her head lightly to the opposite side, I want to go in. Still very tender right there. This little spot, it's hard to describe because you're going across the muscle fibers. So say the deltoids run this way. I was going across the muscle fiber where I was pressing right there. A little bit of pressure. And I just hold. I'm giving her just enough so that she can hang out and breathe. If I press too fast, too deeply, she's going to respond with protection by contracting. Since we're trying to get muscles to unwind, there's no benefit to going too fast or too deep. And go slow. She had some good breaths there. I'm going to lengthen out across the shoulder just to give her a quick break from that. I can hook under the shoulder again. If I want to engage that connection with the neck, I can support with the left hand and hook under. It gives me a chance to mobilize the head while I'm doing this and lengthen those connections. If I'm grabbing her hair, I can just slide it out of the way. You'll see a little bit of redness through there. It's good, just engages cardiovascular system and a little bit of blood flow. I'm going to hook the palm right there and slide big and broad. Not too much? Okay. So if I can't dig into the muscle directly, can you lengthen it? When you lengthen it, when you're engaging movement, you're still getting the origin and insertion of that muscle, and you don't have to know exactly where it is because you're just able to move the person around. I'm always telling my students to use movement like a scanner. I'm moving the person's body to find where the tension is so I can go in and pinpoint that area. We've done lots of movement to roll out, to roll forward. Now I'm going to try to roll back and down. So I've got one palm underneath the shoulder blade. I'm going to put the other hand on top and roll this open so the exaggeration is out this way. But instead of sliding, I'm just going to hook over the shoulder and roll her back. Now I felt a light little clunk. How did that feel?
Like a light little clunk.
Yeah. Did it feel like it was the shoulder joint or more the shoulder blade? Joint. The light little clunk. It wasn't much pressure, just something shifting around. I'm pushing the left arm, or my left arm, in and down. It's tucking her shoulder blade back and down while I assist this rolling open. Doesn't have to be a lot of pressure. There isn't slide. Just rolling this open. If you don't like the hand grip here, you can switch. The main vehicle, you have the coracoid process of the shoulder blade, the shoulder joint. You're over that primarily. So left hand tucks in, right hand's tucking out. You allow your hand to relax. More surface area is good. If you decide you need to change the focus or shape, you can. I prefer a lot of contact with skin. Big, broad contacts are nice. They feel warm, nurturing. You can still engage some movement up and down. But I think she wants more of this back and open. And with my own body, I can sway, I can move. Always keeping in mind your own comfort as you work on someone. If I don't like that hand grip much, what happens if I switch? Same basic movement, but now the right hand is guiding back and down, and the left. This feels a little easier to me, but I'm also left-handed, might make a difference. I'm pushing with the right hand into the back as her eyes rolled back in her head, which we will take as a good sign. Now, this way or this way? The first one, okay? This way or this way? First one, which is what I thought she would want, but the process of giving her the choice makes her feel in control. The emotional response that she has from me giving her the choice says that I'm right here with her, trying to make everything as good as possible. There's a receptivity, not force. It means that she's going to unwind even more because she feels nurtured, safe, protected. I'm pushing on the shoulder blade from the back, rolling that out and open. My hand starts to get tired. I'm going to take the top off, and then this bottom hand is just going to traction on its way out, right across the shoulder blade, and back into that initial movement we had. This shoulder looks completely different to me. It looks like it's rolled out and open now. Most of the changes that happen don't necessarily happen with the tissue itself. My understanding is that her nervous system down regulates. So her nervous system is no longer telling these muscles to contract and hold. We've just facilitated that unwinding process. Hold onto the neck and traction. Just making sure not to pull hair. And when I look at her, this guy looks rolled open. The left looks a little more rolled forward in comparison. You can always do, let's say if they have right shoulder problems, you could do that one twice, the left one once. You can hook around the neck again. Fingers sliding and gliding. And again, I've used no cream. I'm not opposed to using cream, but I actually like traction on skin. Left side of the neck. Feels almost buttery on this side. Mobile, soft, a little bit tighter on this side. I want to focus on this one in the same way. You hook underneath the shoulder blade, roll it back and open. We just want to give her a bit of balance, even though she was having more problems with that right side. Feeling some discomfort. People are often having tightness in different parts of the body. You want the sessions to feel balanced. You wouldn't want to just work on the right side. And hand grip. If you don't like this one, you can always switch it. This feels comfortable for me for the time being. Rolling her up and then out. Contacting skin, I can press again with the left hand into the shoulder blade, making contact with the fingertips into the upper back. So we're rolling open the left shoulder. Even though she was having more problems with the right, I wanted to just make sure she felt balanced. I wanted to give this a little bit of TLC. The left hand is pushing in, The right hand is rolling up and out. I can press with the left fingers along the shoulder blade, hitting the para-spinal muscles around the thoracic spine, into the rhomboids. Technical names, just tissue, just muscle. You can look it up in Google to find out where those muscles are located. The main thing is just rolling the shoulder blade out and open. I can give some traction. I can push, I can pull. Which one of these do you like? Do you like this direction or this direction? She likes the pushing a little bit, so there, but still this way, right? Tons of small movement. Anything that you want to do, just ask. You can get feedback. A lot of the things that I've developed in my practice just came from improvisation. In giving the receiver a choice, you start to develop pattern recognition. It's what I start to joke with my students is Mr. Miyagi from the Karate Kid. He had Daniel wax on and wax off and paint the fence, and Daniel didn't understand why. But Mr. Miyagi had broken down the patterns. He had done it before. That pattern recognition is what I see again and again in the concept of Asian mastery. B.K.S. Iyengar, the yoga instructor who mastered Hatha Yoga. You do it again and again and again and refine it. Rolling that open. There's that little twist. I'm exaggerating my hand movement so they can see that. This direction, and then you like that little push. So I'm going to give her a bit more. I'm seeing if I can roll outside, rolling this open, but then pushing the shoulder down. There. Good? Yeah. And rolling that back and open. There's some pressure from my hand, but it doesn't feel uncomfortable to me. It's something I'm going to be able to hold for a minute. Repetition. Feeling and repetition is what creates mastery in massage and body work. You just work at it again and again. No two people are going to respond exactly the same way. When I have my top hand off, I'm going to traction out slowly. And that little jostle. That feels much more balanced to me from left to right. Always go slow. Don't use excessive pressure, and communicate with the receiver. If you do that in practice, you are going to become amazing at working on people. Thank you for letting me work with you, Missy.